Hawaii's growing homeless population, those addicted to alcohol or drugs, are easily identified. But mental illness is harder to measure and treat. KITV4's Paul Drews reports on the additional challenges facing the homeless.
Homeless residents may not have many possessions, but some are weighed down with depression, post-traumatic stress disorder, or other mental illnesses.
They won't even let me in anyway because the government diagnosed me as clinically insane. Figure that one out. In other words, I understand why I feel like this. You know?
Nationally, around 25% of those who live in homeless shelters suffer from some form of mental illness, while 46% have a combination of addiction and mental illness. But according to the Institute for Human Services, the combined number here is around 60%. Some may not even know they need help.
A function of psychotic disorders is often that folks with those diagnoses who may experience auditory hallucinations, visual hallucinations, of course hearing voices that are directing them or prompting them to do things, and who may engage in a lot of bizarre obsessive compulsive behavior. Those folks don't know that they have a mental illness.
Homeless residents can't be forced to get help if they don't want it, and police are only called in if someone is a danger.
Until something bad happens, until a crime happens, they can't pick up the person and try to take them, to get psychiatric care.
Dana knows from experience as her brother suffers from mental illness.
My brother has been in and out of jail probably about as many times as he's been in the mental hospital.
Like some of the homeless, Dara's brother ended up on the streets after he broke the trust of his family, and their efforts to help didn't work.
You don't realize that this family member needs medication. You think, oh, maybe you could just, be a little stronger, do some yoga, eat healthy, make some good choices. But as a family member over time, I've learned how important medication is to balance out the chemicals that they may lack.
Regular treatment can be hard to maintain when someone doesn't even have a place to sleep.
Being homeless, unsheltered homeless, very much will compound just about any problem or any issue for that individual.
Experts say when homeless get into safe housing, their health, including mental health, gets better, and they're less likely to relapse to drugs or alcohol. Along with more housing, Dana adds, there's also a need for more discussion about how common mental illness is and just how it can be treated.
There's a stigma in our society about taking medication. And we don't talk about depression in depth. We don't talk about drug addiction in depth until something bad happens.
Something those on the streets have seen all too often as they themselves suffer with mental illness.
I want to be helped.
Paul Drews, KITV4 News.
For those dealing with the challenges of a family member's mental illness, NAMI Hawaii has classes to help.